Hello everyone, hope all of you guys are doing well. So in today's video, what you're seeing is an edentulous mandible that's been planned for two dental implants in the anterior region. You can see from 3D rendering view that we placed two virtual implants along with traced mandibular canals and foraminas. So there's no surprise there. And as I was looking at this, initially I thought, well, this ridge has healed well and is ready to receive the implants. Relatively no specific findings. So I was going to sign that case out. But remember that it's important for you to look through the entire area of the scan, not just the areas that's been planned for dental implants. And I hope I emphasize it enough in many of my videos that I've made so far. And this is a good example why getting in the habit of looking at the rest of the scan thoroughly can really make a difference in certain cases. So right here, as I looked at the scan just through the edentulous mandible, I really didn't see much, as in nothing that really concerned me. All these extraction sites have been healed or are healing normally, so that really didn't concern me, and that's probably retained the dental material, most likely, depending on where it is, right? Endodontic uh, material or even just fragments of dental materials that may have fallen into the extraction socket. So that didn't really concern me, and I really didn't see anything that caught my eyes in the axial plane until I saw the coronal plane. So see if you can identify the area that kind of worried me a little bit. Worry may not be the right term, but definitely caught my eyes. Okay, I'm not sure if you've also noticed that area, but if I go toward the end of or the posterior edge of the right mandible, there's this radiolucency. So let's kind of bring that in a little bit. Perhaps I can rotate to better evaluate that area. And we see that in the sagittal section as well. So why this area was a little bit interesting was that there's a discontinuity of the alveolar crest, and we see this somewhat irregular radiolucency extending way down toward the mandibular canal. It doesn't look like a hydraulic shaped or well circumscribed radiolucency, because if you look at the axial view, yes, we recognize the area that's mostly radiolucent, but it's very difficult to clearly define. Well, in some areas, I guess it's clear, but there's other parts of the area that's not very well defined. And if we look at the sagittal view, once again, we see a diffuse area of radiolucency, but it certainly does not have that well-corrugated, spherical, or hydraulic shape of radiolucency. And also, given the fact that this is located in the area of missing, most likely a third molar, and the fact that I have seen extraction sites that never reach the normal trabecular bone density, um, and they appear very similar to this, that I think this is a osteoporotic focal marrow defect. So focal osteoporotic marrow defect, or just marrow spaces, right? Collection of large marrow spaces, which would not require any further investigation or treatment. But I think it's still nevertheless important to see that and go through your mental diagnostic tree that you have to say that this is normal or abnormal. If you are calling this abnormal, then you should certainly perhaps do a radiographic follow-up or order a biopsy. I think this is normal. Again, just a large marrow space. But I nevertheless, I think it's important, again, get in the habit of looking at all different areas of the scan and being able to recognize something like this. That's all I have for you. I initially made this video with a lot more, I guess, explanation and longer video, only to find out at the end somehow it failed to capture my voice. So I'm recording this for the second time and just trying to make things a little bit shorter and concise. Thank you very much once again. Stay safe and stay healthy until we see you next time. Take care. Bye.